Hi guys, welcome to Healthy Living with Nosmo, the channel where health finally makes sense. Welcome to the series 2 of Living Well with Type 2 Diabetes. Now let's get into it. Last week we talked about the root cause. We wanted to know what's going on in our body. This week we want to know what we can do about it, how we can control it, how we can manage it, how we can live well with type 2 diabetes. So to start off, we're going to talk about the mental and emotional well-being of people who have type 2 diabetes, because diabetes can take a mental and emotional toll on people. Okay, the first one we'll talk about is diabetes burnout. Okay, diabetes burnout, and this can happen from constant pressure of having to monitor your blood sugar, having to monitor their blood sugar, the food and medication. What should I eat? How should I take this medication? Oh, I have to take my medication on time. I have to check my blood sugar. It takes a toll, and there's a point to which people get to that they just stop doing all of that. Okay, but again, you can't stop. It's important to stay consistent. It takes time, it takes practices to maintain and live well with type 2 diabetes. It may lead to frustration or even avoiding their own care in general. I've had patients who come in and they haven't checked their blood sugar in months. They haven't taken medication. They eat whatever they want. And what can we do? What can help? So first thing we want to do when people have diabetes burnout is to set small realistic goals and take short mental break away from intense tracking. I'm checking in the morning, I'm checking at night, I'm checking in the afternoon, I'm checking in. Take short mental break away from it. If you're burnt out from just having to manage your food, your medication, and checking your blood sugar, speak to your provider and see what is realistic. Guilt around food is one major thing. I don't want to eat this. When you go out with your friends, you're scared of eating something. You don't want to eat this, you don't want to eat that. It's guilt around food, and that happens to a lot of type 2 diabetic patients. It can cause stress or an unhealthy relationship with food, okay, with just eating in general. What can help? You want to focus on balance rather than perfection. Focus on balance rather than what? Perfection. Avoid labeling food as good or as bad. Speak to a nutritionist, see what they can put together for you. Do your research, speak to your doctors regarding what you eat. Okay, if it's portion control, if it's eating more grains and more vegetables than carbs, speak to a dietitian, someone who can help you come up with what to eat and not feel guilty around eating. It just makes you scared of eating. And again, we remember, we don't want to miss our meals. We don't want to miss our food, because when we do that, our blood sugar drops down. Social eating may cause anxiety or feeling of being different. Okay, these people may have social eating. Now what helps? Plan ahead when possible. Practice simple responses if others ask questions. Okay, if you feel embarrassed, if you feel tired, some people who say, oh, I don't want people to know that I have diabetes, or I don't want to have to explain myself. Think of what you want to say ahead of time. Practice that, plan ahead of time. All right, remember that managing your health is nothing to be ashamed about. Managing your health is nothing to be ashamed about, to be stressed about, or to be embarrassed about. And everyone is dealing with one thing or the other. So do not feel embarrassed about your health. Do not feel ashamed about your health. Plan ahead of time. Practice what you want to say to people. Know what you want to say, and if you don't feel like sharing, then you don't feel like sharing. Okay, it's really up to you what's comfortable for you, but avoid stress, avoid feeling embarrassed about your own health. Okay, do not have that burnout. Do not have guilt around food. Like we said, set realistic goals, speak to your dietitian, and then plan ahead when possible. Okay, plan ahead when possible. Now we're going to go back to the food aspect of type 2 diabetes. There's a healthy diabetic plate. There's a diabetic diet. I'm going to be putting the link down. Once I post this, I'll be putting the link. On a healthy diabetic plate, you can have every variety that you want, but again, it comes down to portion control. It comes down to portioning everything. Okay, there are a few things we need to know about a balanced plate method here. Remember that carbs aren't evil. Carbs aren't totally bad. You need them for energy. You have to maintain portion control. Maintaining portion control would go a long way. Make realistic swaps. Do not overstress yourself. Be realistic. Set realistic goals for yourself. Make realistic swaps. Don't make unrealistic ones, and then it becomes difficult to maintain over time. The best way to live with type 2 diabetes is by combining a change in your lifestyle and proper medication use. Again, a change in lifestyle and proper medication use will help you to live well with type 2 diabetes. And whatever medication you are on, please make sure you're following the dosage. Please make sure you're following it. If it says before meals, with meals, after meals, stick to the timing of the medication. There is a reason why your doctor is saying use it around those times so that it can work well with your body. It do not just decide you want to stop medication, you want to stop everything altogether. Speak to your provider. Over time, like we said before, uncontrolled diabetes can lead to complications, which can cause a person's increased risk of hospitalization, just sickness, body system shutdown. Now, let's get into the aspect of taking control of our blood sugar. Okay, it is important that you check your blood sugar regularly as possible. This will help you make healthier choices, okay, such as healthy nutrition and activity choices that can help regulate your blood sugar. You can check your blood sugar in the morning and at bedtime, depending on what your doctor advises. Okay, so check with your doctor, see what they want you to do, how they want you to keep to monitor your blood sugar. Make sure that you're asking them to help you set realistic goals. Walking after your meal, take walks after your meal. Like I said before, 30 minutes of walk 5 days a week will do you a whole lot of good. Okay, adequate sleep. Adequate sleep. Do not miss your sleep. Okay, do not miss your sleep. Adequate sleep is very, very important. Okay, to managing your blood sugar, to living well with type 2 diabetes, reducing stress. The more stressed out you are, it increases your cortisol level. Okay, and that will cause your sugar to stay high. So, again, reduce your stress, sleep well, exercise after your meal, or get a 30 minutes minimum of 30 minutes exercise daily 5 days a week would do you a whole lot of good. And do not miss your medications. Do not miss your medications just because your blood sugar is within the normal range. I've seen people who say their blood sugar is within normal range, so they stop taking their medication, they stop checking, they stop making healthy choices, and guess what happens? The next time they check their blood sugar, it's at a 600. Okay. And we don't want that because, again, that can lead to the complications we discussed in series one. This information can be for you or for someone that you love, someone that you know. So please share, repost, subscribe, leave a comment, turn on your notification, leave questions for me. I would answer to the best of my knowledge. Okay. And I will see you in my next video. We've come to the end of the Living Well with Type 2 Diabetes series. I will see you in my next video and we'll be talking about a different health condition. Now, if you have a question about type 2 diabetes, please leave it in the comment section. I appreciate your time. Thank you.